How is a TIA or mini-stroke diagnosed by brain imaging? Imagine experiencing sudden weakness or speech trouble that lasts only a few minutes. Doctors need to figure out if it was a mini-stroke or something else. Brain imaging plays a key role in this process. The main tools used are magnetic resonance imaging and computed tomography scans. Magnetic resonance imaging, especially with a special technique called diffusion-weighted imaging, is the most sensitive method to find recent brain ischemia. This technique can detect tiny areas of damage caused by a lack of blood flow that might not be visible on other scans. In fact, studies show that diffusion-weighted imaging can find acute ischemic changes in about a third of patients with symptoms of a TIA, even when the initial CT scan appears normal. Computed tomography scans are often the first step in emergency settings because they are quick and good at ruling out bleeding in the brain. However, CT scans are less sensitive for small or early ischemic lesions typical of a TIA. They might miss recent damage that MRI can pick up. So, a normal CT scan does not necessarily mean there was no stroke. To get a clearer picture, doctors may also perform additional imaging like magnetic resonance angiography or computed tomography angiography. These help visualize the blood vessels in the brain and neck to see if there are blockages or narrowing that could have caused the symptoms. Carotid ultrasound is another useful test to check for narrowing in the carotid arteries, which are common sources of emboli leading to TIA. The typical approach starts with a thorough neurological exam to assess symptoms. If available, an MRI with diffusion-weighted imaging is recommended within 24 hours of symptoms. This helps confirm whether there was an actual ischemic event. If MRI is not possible, a CT scan is done, but doctors keep in mind its limitations. Vascular imaging tests like CTA, MRA, or ultrasound are used to find underlying causes. Blood tests and an electrocardiogram are also important to evaluate overall stroke risk factors. In summary, diagnosing a TIA with brain imaging relies mainly on MRI with diffusion-weighted imaging because of its high sensitivity. It can detect small, recent brain injuries that might be missed on CT scans. While CT scans are faster and useful for ruling out bleeding, they are less reliable for identifying tiny ischemic changes. Combining these imaging techniques with clinical evaluation and blood vessel assessments helps doctors determine the cause and plan the best treatment. Always remember, if you or someone else experiences symptoms suggestive of a mini-stroke, seeking prompt medical attention and getting appropriate imaging is essential for accurate diagnosis and care.